Hello. Now today we're talking about Cervical Cancer Prevention Week. Each year around 3,000 women in the UK are diagnosed with cervical cancer, and although screening aims to prevent cervical cancer, it can also help detect it early. And with early diagnosis, long-term outcomes are much more positive. So I'm delighted to say I've got three guests here in the studio who will each offer a unique perspective on our topic. Firstly, we have Robert Music, who is CEO of Joe's Cervical Cancer Trust, the only UK charity dedicated to women affected by cervical cancer. And we're also joined by two women who have first-hand experience of cervical cancer, and they're here to talk about their experience with the disease. We have Sam Allen and also Frankie Appleyard. So welcome to you all. So Robert, I'll start with you. It is a big week for you because it is Cervical Cancer Prevention Week. So tell me a little bit about what's happening.
Okay, so the week is incredibly important. So cervical cancer is a largely preventable disease, as you touched on. Cervical screening plays a really key role in that. We've got real concerns in the United Kingdom in the numbers of women who are going for screening. On average, over the last 5 years, 3.7 million women haven't attended. Coverage is probably as low as it's ever been in some countries. It's a real worry, and at the same time, we're seeing increased incidence. Okay. So that's a real concern.
So why do you think it's at such a low point at the moment?
So I think that there are a number of different reasons why. But certainly we're seeing concerns in different age groups in terms of why they're not attending. So with younger women, they're not, where only one in three are not taking up that invitation.
Right.
They're not going because the feedback is around embarrassment, about worried about the pain, and not really understanding what the test is for. So again, you touched on before what it's for.
Yes.
And a lot of them think it's a test to find cancer. And interestingly, then they're a bit worried about the results, rather than this is a test to prevent cancer.
Yes, so why don't you explain that a little bit more? I mean, women go along and have a smear test, and actually what they're looking for is abnormalities in cells, isn't it?
Absolutely. So they're not looking to find cancer.
No.
What may well happen, you touched on it before, if they do find cancer, and that's rarer, invariably it can be an earlier stage, and therefore the treatment is less invasive and long-term outcomes are far better. But it is about preventing cancer in the first place, and that's very rare with cancers. But we've got less women going, we've got more people being diagnosed, and the whole point about Cervical Cancer Prevention Week is increasing that profile, raising public understanding as well as health and policy informers that more needs to be done to encourage women to attend screening.
Okay. Now, Frankie, you did go to a screening, didn't you? And
yes.
I think, when did you get you got your first letter? Was it 25, which
yes.
is when you start to get letters? Did you go straight away, or?
I didn't know. I put it off for probably about a year before I went, and I was eventually diagnosed with stage 1 cervical cancer. So as we've just talked about, mine was caught at a very early stage, so it was very treatable.
And an incredible shock, I'm sure.
Yes.
And when you put it off, was it sort of like, oh, I'll go at some point, or did you have to be persuaded to go by your mum, or what made you finally go after that year had passed? Because you could have put it off, as so many women are.
Yes, I think I'd gone to my GP for a different appointment and just happened to mention while I was there, I don't think I've had my smear test yet, so she booked me in for the following week.
I see, okay. And so obviously you've come through all of this very difficult time now, you've had treatment.
Yes.
But clearly it must have been a really upsetting, difficult time. But did you find you had a lot of support around you once you'd had the diagnosis?
Yes, my friends and family were all amazing,
Yeah.
Really good support, and it was obviously a very stressful time, and at such a young age you don't expect that to happen to you. But yeah, I had incredible support.
Okay, so obviously you're talking to quite a lot of people at the moment, which is fantastic to share your story, because it is Cervical Cancer Prevention Week. So what would your message be to young women like yourself who maybe feel a bit anxious about going for a smear?
Just don't make any excuses. None of the excuses are worth it. You just need to go and get checked. If you have abnormalities, they can treat them and prevent you potentially developing cervical cancer in the future.
Okay. Now, Sam, what about yourself then? Tell me what happened. What was your story?
I had my first screening at 25 and had a pretty unpleasant experience there.
Okay.
And as a consequence, did exactly what the statistic is currently saying, is I put off going for my next smear.
Okay.
I didn't go and have a smear for nearly 10 years. And when I did go, when I did get the confidence and didn't think about, the worries, and had a good healthcare professional to talk it through with me, that's when I was diagnosed with early stage cancer.
So again, a terrible shock,
yes.
but treatable.
Absolutely.
And, okay, and at a stage where you didn't have to have too much invasive treatment.
That's right. And again, you know, in terms of encouraging people to go with whether it's embarrassment or whether it's anxiety around just such a short amount of time, when you think about the treatments that Frankie's had to have and I've had to have subsequently, if we could tell the old Frankie and Sam you know, how invasive those experiences are compared to this very small 3-minute
it's slightly uncomfortable,
screening,
but then
slightly
it's over.
uncomfortable, and then it's over. And it could save you that pain and time afterwards. We would both be running to that person straight away.
I think once you've had a baby, you realise it's not painful. It's fine. It's just a little bit uncomfortable. So what are you doing specifically for this week, Robert, just to wrap up with? What have you got going on for the prevention week?
So apart from trying to bang their heads together with the health and policy people, I think in terms of the big awareness campaigns, we've relaunched a campaign called Smear for Smear. It's a lipstick selfie campaign, so it's a great fun and simple campaign where you put on some lipstick, you smear it, take a selfie, share it with your friends, and try and raise awareness about the importance of screening and the role it plays in cervical cancer prevention. Okay. I did it. If I can do it, anyone can do it.
There you go. Well, we'll all be doing our smear selfies, and thank you so much for watching. And if you want any more information, please do go to the Joe's Cervical Cancer Trust website, which is joestrust.org.uk. Thank you very much. Thank you so much indeed, and goodbye.